This program is brought to you by SAMCETA, the San Mateo County Economic Development Association.
Why should you invest the next 20 to 30 minutes of your time in watching? Have you ever wondered about the people and purpose behind various businesses on the peninsula and Silicon Valley? Who works there? Why? What do these companies and organizations really contribute to our communities? If you are even a little bit curious, take a moment and hear their stories and why business is more than the bottom line. For 7 decades, the San Mateo County Economic Development Association, better known as SAMCETA, has championed the business community by convening and connecting them to the communities in which they make their home. People hear about Genentech and Oracle, but do they know about Design Tech High School and Future Labs? My guess is no. So we are going to tell these stories and many more. The stories of your friends and neighbors who work there and how they contribute and collaborate through their employers with our food banks, our schools, our youth sports teams, our art and cultural groups, our veterans and our seniors. How their companies give back and believe in more than the bottom line. On today's show, we have Sherri Sager, Chief Government and Community Relations Officer for Lucile Packard Children's Hospital, Stanford. Welcome to More Than the Bottom Line. With me today is Sherri Sager. Sherri is Chief Government and Community Relations Officer with Lucile Packard Children's Hospital, Stanford. Hi, Sherri. Great to have you here.
Thank you for inviting me. I'm glad to be here.
So it is wonderful to have you as a part of More Than the Bottom Line. And thank you also for being chair of the SAMCETA Board of Directors. We are very grateful for your leadership and your insight and your wisdom. And how I'd love to kick off this episode is for you to tell us about how did you end up at Lucile Packard Children's Hospital, Stanford, in your current role, and a little bit about your history.
I'm going to take a really long story and make it shorter. But I've always been involved in politics, starting in high school and in government, and worked for elected officials. And I joke that I went backwards. I started working for a member of Congress, then a member of the state legislature, then a member of the city council, and then a member of the county board of supervisors in Santa Clara County. After that ended, I was trying to figure out what I wanted to do. I knew I wanted to do government relations. Everything I had always done had been focused around children and teens in terms of my avocations and volunteer services. Mm-hmm. And so I got a temporary job working for the VMC Foundation, doing fundraising and some community relations. And one day, after I'd been there for 3 years trying to figure out what do I want to do next, I got a call from a former member of the Board of Supervisors, a woman named Susie Wilson, who was a great mentor to so many women. And Susie said, "Sherri, are you sitting down?" And I'm like,
Yes, I'm sitting.
Yeah. She said, "I have just found the perfect job for you." She said, "I just came from a meeting up at Lucile Packard Children's Hospital, and they've just gotten board approval to create a new position for government and community relations." Oh, wow. And the VP asked me if I knew anybody who could do that job, and I told him you could, so get your resume up to him immediately. And I said, "Yes, ma'am." And I sent in my resume, and that was 25 years ago, and the rest is history.
Well, Lucile Packard is so lucky to have you, and there's been some exciting things happening at the Children's Hospital the last few years. So can you give us a little flavor of what that new big thing is?
I would be delighted to. And actually, let me just do a teeny bit of history to show why this is such a big deal. Lucile Packard Children's Hospital is still a really young children's hospital. It'll be celebrating its 28th birthday in June. And in those 28 years, we've had several metamorphoses. And since 2000, we've been on this upward trajectory and focusing really around children with complex healthcare conditions hard to diagnose, hard to care for kids. Those are the ones we specialize in. And we ran out of room. And so we just opened up a little over a year ago a brand new hospital that is state of the art. And until the next big hospital opens up, it's one of the top technologically advanced hospitals in the country, definitely in the children's hospital world. It's also an environmentally friendly hospital. We achieved a LEED Platinum, which is important to us.
That is fantastic. And we're going to turn right now to see the video on the new Lucile Packard Children's Hospital.
How do you build the best children's hospital in the world? Start by putting it on the campus of one of the most respected medical and research institutions on the planet. Find people who think industry standard has standard written all over it. Treat next-generation Californians with next-generation technology. Practice complex surgeries in virtual reality before performing them in actual reality. Make your carbon footprint kid-sized. Put medical imaging and surgery in the same room. Make sure kids get to be kids. Embrace the healing power of a wolf. Attack tumors with sound waves instead of surgery. Find new ways to keep kids calm in stressful situations. And remember that you're doing more than expanding your footprint. You're expanding your capacity for care. But above all, be fearless. Because when building the best children's hospital in the world, you don't just follow best practices. You write future ones. The all-new Lucile Packard Children's Hospital. The center of the Stanford Children's Health Network. Access to excellence.
What a great video we just got to see. And Sherri, what I'd love for you to tell the audience about now is Packard 101. I had the privilege several years ago to go through the program. Could you describe what Packard 101 is?
I would be happy to. And let me just touch, because we just saw the video. One of the things Packard is always focused on is having family-centered care and treating the whole family. And what we realized when we first started having government and community relations is that unless you had a child who needed to be in the hospital, you didn't even know who we were. We were just something that was over on the other side of El Camino Real. And so we looked at and said, how do we let people know what a resource they have in the community? And from that, Packard 101 was born. Packard 101 is a day and a half in the life of the hospital. It's, the big buzzword these days is transparency. I don't know how you can get any more transparent than what we do with Packard 101. It's invitation only. It's a small group of folks. It's community leaders, elected officials, hospital board members, foundation board members. Sometimes the foundation asks me to include prospective donors. There are no asks. It's not about, we want you to be a fundraiser, we want you to support something. It's about what happens in a children's hospital, what happens behind the scene. So you come in, you take a tour of the hospital, you get a presentation by one of our parents telling you what family-centered care means from a parent perspective. Then you have one of our faculty members tell you about the research that they're doing or a new treatment that they've discovered or they're working on. And so you get to hear something that's brand new. And then you come back the next day and you go through what we call your HIPAA it's the privacy rules, and you get trained in HIPAA, because for that day or so, you're part of the Packard staff. Then you go to grand rounds with all of the pediatricians and the community pediatricians and hear another presentation. Sometimes it's one of our faculty members, sometimes it's a visiting physician. And again, hear how it all fits together. And then you start rotations. And the rotations could be anywhere from shadowing somebody in housekeeping to one of the top pediatric cardiovascular surgeons in the world, and everything in between. And you're there in the room watching, getting a chance to interact and actually see what happens. And then we finish up with a few more presentations in terms of what's timely. So during the building of the hospital, we do updates on the new building. Mm-hmm. Sometimes when there was pending legislation that was of importance, like the Affordable Care Act, we do a presentation on what did the Affordable Care Act mean to children's health. And then open it up for questions and a debriefing and have a graduation ceremony.
I think for me personally, when I went through, it was eye-opening. I mean, I'm a parent, so to know that I have this resource in our community is fantastic. And the fact, Packard 101 is just one of the many community benefits that you provide at Lucile Packard Children's Hospital. Can we talk more about the community benefits? Because one of the premises of the show, as you know, is more than the bottom line. And while every institution, organization needs to make money and be able to support itself, there are so many community benefits tied to Packard, and I'd love for us to get into that discussion.
Happy to. We do, like all not-for-profit hospitals do, every 3 years a community health needs assessment. And we work in partnership with the counties, with other hospitals, with other community leaders.
And you focus beyond, you focus San Mateo County, Santa Clara County.
And so those are our primary focus. But we do some programs down in Santa Cruz and in Alameda County. And so some of the issues that come up for all hospitals are access to care and adolescent mental health. And so we've really done a lot of focusing. And we also look, how can we leverage our resources? So how can we, with our investment, encourage others to make investments? So we have been partnering in East Palo Alto with the Ravenswood Family Health Center since their inception. I was fortunate enough to be on a task force with the county that the feds called to create a new community health center in East Palo Alto, and we've been involved with it ever since. Everything from having...
And it's going back how many years?
It's
roughly?
going back, it's about 15 years,
wow.
Maybe 16. I tend to lose track. But it could be, right now we're supporting a pediatric dental clinic. In the past, we've supported pediatricians, we've supported behavioral health. It's what their need is, but we've also been their safety net. And so we work closely with them, and we're so proud of what they've done and what they've become. And what we're proud of the most is that we've been able to bring high quality pediatric and maternal health to the community so that people don't always have to drive to us, but that we drive to them.
You embed yourself in the community. I mean,
do.
That's a part of your philosophy. And I think when you think about that, the fact that you called out for other health institutions to think about that, what one piece of advice would you give to them about embedding in the community?
I think when you embed in the community, you are able to build trust, that you're there for the long haul, that you feel that this is part of your community and you want to make your community, whether it's small or large, a more healthy and active community, and work with them. When you don't embed in the community, it's easy for the community to become distrustful and say, well, they're here today, but they'll be gone tomorrow. And the very first assignment I got from our then COO, probably close to 25 years ago, was, Sherri, let's work with East Palo Alto. Let's work with them to make a difference. It was never about us coming in and saying, we know all the answers. It was, we have some resources. How can we work with you? What are your needs? Where would you like us? How can we be a partner with you?
That is such great words of wisdom and thought and how really to engage the community. We'll be right back, folks, to More Than the Bottom Line. This is Roseanne Faust, your host today, and with me is Sherri Sager, Chief Government and Community Relations Officer with Lucile Packard Children's Hospital, Stanford.
20 years ago, we were the first to launch a mobile adolescent health services clinic in the Bay Area, the Teen Van. The Teen Van started our community outreach programs. It also laid the groundwork for the community and injury prevention programs we now have in place. We're a true childhood injury prevention program in the sense that we use data from our trauma surveys and work with our emergency department to get information on the leading causes of injury for patients who are admitted to our hospital. We use that data to drive our programs to the areas we need to focus on for injury prevention. Kids are so open to learning, even at a young age, and I think that's what makes our work even more meaningful, that we're giving them tools that they're going to take with them for the rest of their lives.
Welcome back to More Than the Bottom Line. We just saw a fantastic video produced by Lucile Packard Children's Hospital, Stanford. With me today is Sherri Sager, Chief Government and Community Relations Officer. Sherri, could you tell us about the Safetyville video? Because that was incredibly cool.
Well, we've been working on injury prevention for a number of years, doing a lot of car seat fittings and passenger safety. And we had this opportunity, probably 4 years ago now, when we were building the new hospital. The contractor, DPR, came and said, we want to give back something to the new hospital. What can we do? How can we volunteer? How can we be helpful? And the Director of Volunteer Services also is in my department. And we had this conversation, and the injury prevention staff said, we've been wanting to do a program that we could take to schools and community centers around all sorts of injury prevention, bike safety, passenger safety, pedestrian safety. And so they got together, and the result was that DPR built for us Safetyville.
And DPR is a Redwood City-based construction company, so I love that.
Yes, and it's 9 buildings. It's, we've got a school and a church and a hospital and a fire station and a police station, and we've got turf for roads, for grass. We've got grassy areas and we have roads.
And it's all mobile.
And it's all mobile. It takes up a large space, but it's all kid size. So kids can go through and learn about stop signs and stop and traffic signals, bicycle safety, pedestrian safety. We bring it out to schools. There's a curriculum that goes with it. So what do kids know beforehand, after they've gone through? What have they learned? How can they be safer? And
kids must love it.
The
reaction you have, and probably the teachers, everyone feels like, wow.
They do. It's an easy way and it's a fun way to teach about safety.
And the whole idea of injury prevention and adolescent health, and one of the things I know we wanted to touch on today within adolescent health is mental health services. We've had issues throughout our area, throughout our country with young people. So maybe you could talk a little bit about.
So we've been doing a number of things, and so when we first had the suicide cluster in the Palo Alto area with teens, everybody was sort of talking over one another. It's like, if you do this, if you do that, and we listened to that. And Dr. Steve Adelsheim, one of our child and youth psychiatrists, he and I started talking about how can we get everybody into the room together to be listening to each other. So we created a conference that had 5 audiences. It has adolescents, it has parents, it has educators, it has clinicians, and it has policymakers. We've held 2 conferences so far. Our 3rd one will be in 2020. And what we've done is, on our steering committee, all 5 of those audiences are represented, because it's really important to have the teens there, for the adolescents to say, what is it that they want to hear? What do they need to know? What resources are they looking for? And then to have their parents hear that.
Yes, and then have the policymakers.
And hear the policymaker. So we had more than 500 people come to our last conference. But what's more exciting than that is some of the workshops gave them skills and hands-on. And I know that some of those teens have gone back to their high schools and created adolescent mental health wellness centers on their campuses.
That's fantastic.
That they know that there's now a place that they could go, and it's okay, because part of our goal was to reduce stigma. This is really for all of us. And we were talking earlier about partnerships. Well, this is one we reached out to our other hospitals and said, this is an issue for all of us. Won't you be one of our sponsors for the event? So
I'm sure, did they all jump on board?
They did, because this is what it means to build a community, to build that village. And that we all have a whole continuum of programs that start with, intensive outpatient programs. But unlike physical health, even more so with mental health, it needs to be specific to that individual. You can't just say, oh, well, you've got a mental health issue, you're bipolar, so you get this treatment. Not every treatment works for every child or every teen. So you have to get the right treatment. And so being able to share with audiences at the conference the different types of treatment, the different things that are out there, has been really helpful.
And I think you said it so well, is you, through these conferences, really reduce the stigma. And that is the fear. There's something wrong with me. There's, I don't want to share. And I think that reduction of stigma around youth and adolescent mental health, I mean, that must be just gratifying.
That, but also when we were first putting this together, every person I talked to about us wanting to do this and doing it had a story to tell. And in many cases, had never told their story. So what became really clear is every family has a story, whether it's somebody in your immediate family, your extended family, a friend. All of us can relate to it, but none of us were talking to one another because of the stigma. And if we get people talking about it, that's half the battle, because then for the teens, it says to them, there's nothing wrong with you. We could get through this together. There's help out there. Let's work on this.
And Sherri, it makes me think about your time in your position, but your past positions. And I'm struggling because I'm thinking about, you are all about building community. You always have been. You get that we're stronger together than we are apart. And I'd love for you to touch on, you mentor a lot of people. You've mentored me, and I'm incredibly grateful. I know folks in your office, both men and women, who you've mentored. So how do you do that? I mean, tell us about mentoring, and you just give back in so many ways. I just want you to share.
Well, one, I had wonderful mentors growing up, so to be able to give back just means a lot. But sometimes it's just as simple as being there, listening, letting people know that there are other opportunities, what they need to do. But working with them, what do they want to do? Not having it being limited. Probably the best one for me was one of my nieces, who's right now is a junior at the University of Oregon. And so she's been part of our steering committee on this conference for a long time. And about a year and a half ago, she texted me that she had, reread all of the minutes from the meetings and everything, and all of a sudden had the breakthrough and said, I can't believe I just realized this is what I want to do. You're doing what I want. How can I do even more? And she changed her major to social work, to sociology. She came down for the conference and really getting into it. But it's about giving people opportunities to explore. And exposing them and having them know that there's a safety net, that they can take chances, and that people believe in them, and that there's support for them.
Tell us a story about a mentor that you had that sticks with you, if one comes to mind.
Probably, there actually are a lot of them. High school government teacher, but I'm going to pick on somebody that's fairly well known. My first boss after college was Congressman Norm Mineta, and he had just been elected to Congress. And in those days, you do interviews, and people would come up to you, especially when you were just out of college. What do you want to do in 5 years? What do you want to do in 10 years? And it's like, I don't know. I barely know what I want to do now. And Norm had a philosophy that said, if you do a good job now at what you're doing, opportunities will arise. If you're too focused on where you want to be 5 years from now, 10 years from now, it's too easy to miss other opportunities along the way. So focus on doing a good job now, and other opportunities will occur.
And to me, that's kind of a key of a successful leader, someone who is successful both in the organization, as you are at Packard, that is successful, and you're on multiple nonprofits, and you have served on multiple boards. And I think that ability to kind of look at the person and say, what should I expose them to?
Well, and it's about listening. So one of the things that I've always liked about all of my jobs is that I get to do a little bit of a lot of things. I worried when I worked for a member of Congress that I wasn't going to have any, work skills or, marketable skills because I was, a generalist. I knew a little bit about a lot of things. Well, it turns out that's a good thing because what I do now is I look at all the different things that I do and I see how I can bring them together so that when I'm doing something with a program like Project Cornerstone, which helps young people to thrive, and I look at what business leaders are looking for when I'm working on the SAMCETA board or joint venture, it's how do I bring those two together? Because there's benefit in both.
You're an incredible connector. You're an incredible leader. We are so grateful that today on More Than the Bottom Line, we had Sherri Sager, who is Chief Government and Community Relations Officer with Lucile Packard Children's Hospital, Stanford. Our community is fortunate to have companies like this and organizations that really become a part of the fabric of the community. Thank you, Sherri, for being with us here today.
Thank you so much for having me. This was my pleasure.
On today's Guess the Company segment, we have a company that created the first synthetic insulin for Eli Lilly to test in human clinical trials. A famous quote from one of the founders: "I don't want to hear that word, impossible. Tell me what you need to get it done." This company has received 20,000 patents, and this company has 40 medicines on the market today. The company is Genentech. So Genentech was founded in 1976 by the late venture capitalists Robert Bob Swanson and the biochemist Dr. Herbert Boyer. Genentech has almost 1 million square feet of research space. In 2009, Roche Holdings acquired full ownership of Genentech for $46.8 billion. Roche had had a majority interest in the company since 1990. But Genentech is known for more than its bottom line. Genentech for Good, taking on childhood adversity, Future Lab, which is their science education program, the Gene Academy, Helix Cup, and Science Garage, and their commitment to the city of South San Francisco. Thank you for joining us on today's episode of More Than the Bottom Line.
This program is brought to you by SAMCETA, the San Mateo County Economic Development Association.